Hello athletes, I want to look at physiological aids now. So the second part video to ergogenic aids, and we're going to look at physiological aids this time. They're used to increase the rate of adaptation by the body to increase performance. Some are illegal, such as blood doping. Others, like intermittent hypoxic training and cooling aids, as you probably guessed, are commonly used and are legal in sports. Moving on, let's look at blood doping. What is blood doping? There's two types of blood doping, or if you research it, you'll see there are two sort of different types. An illegal method of increasing red blood cell content. Now, in your red blood cells, obviously you're carrying oxygen, you're carrying hemoglobin, and you're carrying oxygen within them. Blood is removed from the athlete and frozen around 4 weeks before competition. So there's two ways of actually doing it. The athlete can remove their own blood, or you can use someone else's blood which has a match to yours, which is obviously more dangerous to do and can be detected. The body naturally replaces that blood removed from your body, and 2 hours before an event, the removed red blood cells are infused back into the body. Now it'll only take about 48 hours for your body to regenerate the plasma removed from your body, and typically I think in blood doping you take between 1 and 2 pints, probably a pint of blood. And that would take about 4 to 8 weeks to replenish. It says 4 weeks in this slide, but typically I think about 4 to 8 weeks to replenish those red blood cells. And an interesting fact about red blood cells, they can live for 120 days, and then when they start to show signs of wear and tear, they are replaced. Body is amazing. Prohibited in that competition. It's hard to detect through blood, as athletes use their own blood. If they're using other people's blood, it can be detected, but there's still not really a reliable test that can check for blood doping in this context. What sports is it used for? Endurance performance, such as cyclists. Tour de France, very common in cycling. So just some info on this. I think after the Olympics in Mexico in '68, people started to appreciate more the effects of training at altitude. Obviously Mexico being at altitude, and after that they started to look at other ways of increasing their oxygen carrying capacity, and that was blood transfusions, blood doping. I think in these, was it the LA Olympics, the USA cycling team were sort of boasting about the transfusions that they'd been using within the Olympics, because it wasn't banned until 1986. Crazy. What are the benefits? Obviously increases your total blood volume, red blood cell count and oxygen carrying capacity, increased intensity and duration of performance before fatigue, delays your lactate threshold, it improves your performance and increase aerobic capacity, 5 to 13% increase in VO2 max. So you can see the obvious benefits from it, but it is dangerous. It increases your blood viscosity, which is the thickness of your blood. It can decrease your cardiac output if we don't want it to happen, but again, because that viscosity, it becomes difficult for the heart to move the blood. Increased risk of heart failure and blood clots, risk of infection, HIV, hepatitis if you share needles or you use someone else's blood, and obviously bans, fines and tarnished reputation if you're caught. Here's a little flow chart to show you how it works. So you remove 1 to 2 pints of blood from the athlete, freeze it. You have to freeze it, and you can freeze blood for up to 10 years, but you'll gradually lose red blood cell content as it's frozen. So the shorter period it's frozen for, probably the better, but you obviously have to allow your body to replenish the red blood cells that are taken out, and that's what happens there. They replenish the removed blood cells. 2 hours before an event, reinfuse red blood cells in a saline solution. You can actually remove the red blood cells from the blood plasma. Might make it easier to do and easier to store. Athletes compete with increased red blood cell and oxygen carrying capacity, which in a league sport could be the difference between a gold and silver medal or no medal, and a bronze medal, for example. Next method, physiological method, is intermittent hypoxic training. Now, hypoxic means low oxygen. It's a process where athletes live at sea level and train under hypoxic conditions. This means less travelling, less disruption to training and cost for the athletes' teams. Altitude training without the altitude, so you don't have that travelling expense. It's legal. What sports use it? Endurance performers such as marathon runners and triathletes, boxers have used altitude training commonly, and also intermittent hypoxic training, which mimics altitude training. What are the benefits? There's potentials to increase red blood cells, hemoglobin volume and oxygen carrying capacity, increased intensity and duration before fatigue, stimulates muscles to adapt and increase mitochondrial density and buffering capacity. So it will improve your aerobic capacity and VO2 max. What are the risks? Any benefit is quickly lost once intermittent hypoxic training ends, because your body will readapt to its existing condition. Whereas with actual altitude training, those effects might be a bit more prolonged, and experts suggest that with altitude training you're probably going to peak after about 3 weeks of doing the altitude training, so you can actually take a bit of time before performance, whereas with this probably ends a little bit quicker. Motivation can be lost and training patterns affected. Obviously it's tough to train if you're in a altitude chamber, environmental chamber, or you've got a mask on. It becomes very difficult to train when oxygen is being restricted, so it's not particularly enjoyable for the athlete. And there it says that hypoxic conditions are tough. Normal training levels or intensities might not be reached. Can decrease your immune system, and obviously dehydration could be an issue as well. How's it done? It's performed with aerobic and HIIT training, where a mask is worn that restricts the amount of oxygen or air that can be inspired. And like I said before, you can get environmental chambers that can change the percentage of oxygen in the air. The mask can be removed in the rest interval. An altitude generator can reduce the oxygen percentage down to 9.5%. This mimics conditions of altitude of 6,000 meters. I just read that the experts are suggesting that probably around 2,200 meters is the optimal altitude to train at. 6,000 is very high. 4 to 8 weeks has a program work of high intensity work. You might use intervals of 1 to 3 minutes of aerobic work, or intervals of 15 to 40 minutes under hypoxic conditions. Relief intervals will be under normal conditions and last 1 to 40 minutes, so you'll take the mask off to do that. So you might have more high intensity bouts of 1 minute, for example, and then resting, or you might do a lower intensity between 15 and 40 minute effort and rest there, depending on what your sport is and what your goals and outcomes are. Typically you would do it, train with it about 9.5 to 14% oxygen, and you know that the regular amount of oxygen in the atmosphere at sea level is about 21%, so there's quite a reduction there, and it's quite difficult for the body to adapt to that. Hypoxic exposure may be more beneficial than training, and that simply just means maybe living or sleeping in hypoxic conditions rather than actually training in them, because you can still adapt. Your body will still adapt to the lower oxygen conditions even if you're not exercising. Okay, cooling aids. What are they? Aids such as ice vests and cold towel wraps can be used pre-event to reduce core body temperature. This reduces thermal strain and allows a sustained intensity and speed for increased duration. Also used to treat injuries and post-event to reduce DOMS. Now, you've probably heard of cardiovascular drift, which is a sort of non-linear increase in heart rate when you're training, because your body is essentially trying to keep cool or trying to remove heat from your body so you can maintain a healthy body temperature. This is what cooling aids are good for. They allow your body to stay cooler for longer and therefore delay lactate threshold, therefore delay fatigue, etc. What sports are they used in? By endurance performers in hot, warm climates, typically, where you're going to get hot quickly. These will help you to prevent that from happening. The benefits: reduce core body temperature, decrease sweating, dehydration and early fatigue, decreased injury and reduced swelling, increased speed of recovery, and decreased DOMS, which is delayed onset muscle soreness. The risks are it can be difficult to perceive exercise intensity because the ice or the cooling pack or whatever it is you're wearing is almost masking that. You know what it's like when you put an ice pack onto an injury. If you've hurt your ankle, for example, it takes the pain away, so you perhaps feel that you can put weight on it, that you can play on in a game of football or basketball, but actually it's the ice that's masking that pain. Similar effect here. Potentially you could get ice burns if you don't apply it properly. There it says can mask complicated injuries, chest pain, and reduce deficiency in the elderly. If you have any chest conditions or are elderly, this isn't advised. And there you go, dangerous for individuals with heart conditions when used at a chest region if it's a cooling pack, a cooling vest, for example. Okay, so cooling aids, and these are pre-event. It does mention post-event there. And again, you might use a cooling aid after an event, or if you're an elite athlete, a cryogenic chamber, for example, just to sort of help to reduce swelling and any damage, any microscopic tears that are produced from the exercise that you do, which may help to increase recovery, reduce that swelling. There is lots of research on ice packs. These are legal. And that's it. Good luck.